I'm Shelby Brantley at Body and Face Plastic Surgery. You hear often emphasize the importance of being board certified. Board certification is a process you go through at the completion of your residency training. So in plastic surgery, when I trained, did general surgery initially, and general surgery was a 5-year program. And then after that, you matched into plastic surgery, and that was 2 additional years of training in plastic surgery. Now most of the plastic surgery programs are integrated, meaning that out of medical school, the med student matches into an integrated plastic surgery program where plastic surgery is the emphasis for the entire duration of their training, which is 6 years now instead of 7 years. And at the beginning, the first couple of years, they do get some training in, say, orthopedics, general surgery, pediatric surgery, emergency medicine, that type thing like that. So I think that going to an integrated program was, probably a smart thing in the evolution of plastic surgery training. At the completion of your training, then you are eligible to sit for your board. And your boards consist of a didactic or a written test portion of it initially. And so you study for that, and then you take that portion, and assuming that you pass it, then you're qualified and eligible to take your oral boards. And the oral boards, at the time that I did it, which was a hot minute ago, going and you presented cases, and I believe it was 10 cases. So 10 of my cases of different sorts, a cosmetic case, an emergency case, a breast case, a liposuction case, a tummy tuck case, a host of different cases. You got all that data together and you took it with you, and then you had the interviewers who would ask you questions about, why did you do such and such this way, or would you change what you had done, that type thing. And then the other portion of it, doctors that were board examiners would be their cases. They may have case examples saying, if you were presented this, how would you address it? Or can you draw for me, where you'd make the incisions in order to correct, say, a cleft lip or a cleft palate or whatever it may be. And then they made a determination as whether or not, you were a candidate to pass your boards. So once you did that, then you had to continue with your recertification, and that's an every 10-year process. American Board of Medical Specialties recognizes different fields or subsets of medicine, and one of them that they recognize is plastic surgery. Essentially, I think board certification is extremely important. Warrants that you have the ability and that you have been benchmarked against your peer group, and that people who trained you and that are leaders in our field said, hey, this person's qualified. I think it was a year or 2 years before, certifications were basically lifetime certifications. Now it's every 10 years a renewal process. And anyway, while that's not too arduous, it does require that you get continuing medical education hours, that you do testing, etc. It's certainly of merit if you're a patient to ensure that your doctor is board certified, and in my case, plastic surgery.